I'm Dr. Truesdale. I'm a double board certified facial plastic surgeon and I work in Beverly Hills, California. Forget what you know. I'm here to show you the real. What does it really like to be a plastic surgeon? What is it really like to take someone back in time? To make them look different, to make them look prettier, or just to give them a boost of confidence with a subtle enhancement. I perform anything in the face. I mean, I do it all. Hair surgery, facelifts, nose surgery, anything that you can think of to make a person's face or neck look different, that's my jam. I'm pulling back the curtain on my practice to show you the real people, the real procedures, and the real results. This is about real life journeys, inspiring transformations, and the power of feeling confident in your own skin. We'll explore everything from subtle enhancements to life-changing transformations. I'm gonna share my story, the stories of my patients who've entrusted me with their faces and their dreams. Almost no one knows how stressful my job is, but the moment when someone sees their new reflection, that's why I do this. Because changing someone's face can change their whole life. This is beyond the surface. So we've been flirting with the idea of getting a new operating room for quite some time, basically because you don't want to get an operating room and then basically be house poor, right? You don't want to buy a house before you can afford to live in it. And an operating room is a very expensive house. All of the equipment can be upwards of $1 million. And if you're not using it frequently enough, it puts financial stress on your whole practice. So I didn't want to jump the gun and kind of build an operating room out before I actually knew that I could be busy enough to support it. Over the last few months, over the last year, we've gotten quite busy. And so we started having a little discussion here and there. Hey, wouldn't it be nice if we had our own place? Slowly but surely, I built up enough confidence to say, hey, I think it's time. Let's pull the trigger. Hello.
Hello.
Welcome to LA.
Thank you. My name is Cammie Ritchie, and I am 60 years old. I am from Portland, Oregon. I'm a mother of 2, and I am here to better my confidence.
I'm excited for you. It's going to be the beginning of a beautiful journey. So, welcome to California. Have you been to LA?
No.
Okay, so the brand new experience, Los Angeles, Beverly Hills, facelift and everything. Thanks for coming. So in your own words, tell me, I know we've already reviewed this virtually, but this is the first time we get to meet each other in person. Tell me what our goal is. What would you like to achieve?
The sagging skin. I want to go back to my younger days of looking.
Gotcha.
I was looking.
How long have you been thinking about doing this?
Probably the last year, about a year.
About a year.
Yeah.
And then how did you find me?
My daughter.
The daughter. She sent you like
Pictures.
my post or something?
Yes, your post.
Cammie is our wonderful patient from Oregon. She's 60 years young and she wants a refresh. So for her, I'm gonna go a top-down approach. I'm gonna do her upper eyelids, her lower eyelids, as well as a skin pinch, some fat transfer, and a face and neck lift. Very excited because she's going to look amazing. So when I think about making people look younger, which is what your goal is, I reverse gravity and add volume back in.
Okay.
And so if you look in the mirror, let's look at all the little areas. So your eyelids obviously have a little bit of extra skin, but also a little fat. Now the one thing that I'll draw to your attention, because I see everything, you see how this brow is a little bit lower than the other one? I'm not going after that. So if we wanted to do this, this would be a brow lift as well, okay? We don't have to, because you probably always have had that brow a little bit lower, okay? So we're not really making you look different, it's just refreshed, okay? The lower eyelids, as we age, we lose bone, and this bone gets bigger, and the eyeball kind of basically doesn't have as much support, and then the wall that's holding this fat inside loosens. So this fat that's pooching out is gonna basically get smoothed out, and all the extra skin is gonna get smoother, so it's gonna look more like that.
I am hoping to see the transformation from the saggy skin to the radiant me again.
Yeah, it's gonna look pretty. Yes. And then the major thing is the face and neck lift. So like you've seen on my Instagram, this cheek is getting lifted.
Yes.
How would that make you feel?
Great.
Yeah. What about the neck? So this is coming up, and then no cheating, no cheating.
No cheating.
Yeah, because the idea is that you can keep your neck down in any position and not have a bunch of extra loose stuff. So when people come to me, they say, you know, I'm always doing this in my photos because it's extending the neck,
Right.
and it's making it look better than it really is. So it's kind of fake. So I want to do this and this, so that even with your chin being down, it still looks as smooth.
Yes.
Yeah, and then we're gonna take some fat and then add it to your face to add some areas where you need a little bit. For you, if you look in the mirror, those areas are your cheek. And you can see this little line here. We're gonna add a little bit of apple to the cheek, a little bit to the chin, and then the area around the jawline. And maybe a touch, maybe a little bit in the temple, not too much.
And the temple is here.
Yes.
Okay.
So fat transfer is an amazing way to complement lift, because when we age, volume changes happen, right? In our soft tissue and the muscle and the bone, right? People don't think of the skeleton as a living thing, but as we age, it gets smaller. And then because that structure is getting smaller, everything else doesn't have the same form. So fat transfer is a really nice way for me to actually complete the puzzle and deal with both the lifting, but also giving back volume. So what I usually do is I liposuction some other part of their body, like their leg or their belly, their arm, and I steal that fat and I move it to the face, where then it has a new blood supply and it lives. So unlike filler, this is permanent, and I can really contour pretty much every aspect of their face, from their forehead to their brows, to their cheeks, to their chin, to their folds. All of those areas, those micro and minute changes that are happening on the skeleton and soft tissue get restored. So in terms of after surgery, your daughter's coming to town? So I'm gonna give you guys a call in the evening. I'll speak with you after surgery, but you won't remember. And then you'll come back the next morning. You're gonna look great, but you'll be a little swollen, a little bruised. You'll come back 7 days later, and then I'll take all the stitches out. How long are you gonna be in town?
9 days.
Perfect. And then any plans for the summer?
At this time, no.
Yeah?
Just healing and getting it.
Well, like I said when we spoke on the call, most people look great after a month.
After a month.
2 weeks you'll look fantastic, but a month you should look really, really, really good. 3 months is when you're like, okay, put me on TV.
We're here.
Yes, we're here. We're here, exactly.
Here.
Some people dream about being rock stars or movie stars, or maybe having some exotic car. For a surgeon, one of the things that we dream about is having our own operating room. That's like having your cake and eating it too. This is amazing. I've been able to help design this place from the ground up and really have tried to focus and pour my heart and soul into it so that it is the safest place on earth. I've been able to build my own temple, and this is the place where I get busy. This is where we make it happen. This is where patients' lives change. This is where I'm super at home. I spend more time here than I do in my own bed. Some people say Disney is the happiest place on earth. Well, the safest place on earth is my operating room. When I say it's the safest place on earth, what I mean is every single redundancy that you can think of for a patient emergency, anything that I come across, or even things that I don't come across, I wanted to have a solution and a backup solution in case it were to happen. Listen, this is the place where I'm gonna operate on my mom, so it's gotta be really amazing, right? And so if I think about every single thing that might go wrong, and I think about the solution or the things that we might need, whether that's a backup generator, the code might say we need 2 hours of extra time on the generator. Well, let's do 6 hours. Let's make sure that whatever we have, whatever might happen, we've got a solution for it. Cammie's here for her follow-up, and I cannot wait to see her. She's coming back after 30 days, and she sent a couple of videos, a couple of photos as a sneak peek. I've been waiting to see her in person, hug her neck, Can't wait to see. Hey. 1 month, welcome back. How's this process been? How's it feel? What's your life been like?
Right now, life has been good. When I look in the mirror, I'm not doing this anymore or lifting this chin up.
Nice.
I go in there and it's all done.
Nice.
Yeah.
Are you back to work? You doing your daycare?
Yes, I'm back to work.
And you got your energy back?
Energy's there. CMOS is working just great.
Nice. Well, you're healing beautifully. I was looking at your incisions. So, I mean, under the chin, this area is a little thick. We might want to inject that with a little bit of steroid. But otherwise, chin down for me. Your eyelids are healing beautifully. Close your eyes for me. I mean, that scar is healing really, really finely. It's super hard to see even with your eyes closed.
I decided to do this for me. I'm getting older and I just want to look fabulous as I get older.
Gone. Your jawline is super, super, super crisp. And even some of this is still swollen. So this is only going to get better with time. Your incisions around your ears are healing beautifully. Super hard to see. I mean, you look, you're my poster child.
Well, thank you.
Yeah.
I haven't told anyone but my mom and my daughter and my niece. And right now, everybody think I was in a car accident. So, because my face was so swollen when I went home. So when they see this, they're gonna know the truth.
So, and then what's your family said? Have they seen you yet?
Well, everyone's seen me, but they don't know.
They don't know.
I had the surgery.
They can't put their finger on it.
No, they just think I was in a car accident.
A car accident? From the initial couple days?
Yeah.
A car accident where you come out looking younger?
No, a car accident when my face was all swollen and going through that, and now they think it's just gone down and theirs hasn't.
Well, your secret is mine.
Yeah.
Until the show comes out.
Until the show comes out. And I'm gonna be sending it to everybody. You guys look.
Like, remember that car accident? It was a truck named Dr. Truesdale who hit me.
Feels good. I remember just being able to get up and wash my face because I don't wear any makeup, and wash my face and go. And that feels good today, you know, and versus me being 60 years old and always picking, you know, doing this, you know, lifting it up. How would I look if I did that or did that? But feels good. I don't have to do that anymore. The
contours are all improved and improving. You know, the under or the upper eyelid, you had that bag that was pooching out. Now it's super smooth. Your under eyes are smoother where we put in that fat. And even this is you're still a little swollen because you're only 1 month out. So I anticipate that as you continue to do lymphatic massage, as the skin continues to unswell, that will look even better. The jawline, it looks super crisp. The face, not loose at all. But all of this swelling that's down here, remember, all of the swelling that's up here starts to collect and it kind of gets kind of dammed off in the neck. But even that being the case, the neck already still looks better than where we started. But when this starts coming up, it's going to be more like this.
You're talking about this?
Just a little bit of swelling that's right here in this area.
Okay.
Because you can feel kind of how it's a little firm. That's super normal. Again, but right now I'm loving what I'm seeing. You see her nice structure. Yeah.
There she is.
There she is. Let's go.
I was just starting to have a saggy neck a little bit, and you know how you notice things about yourself other people probably don't even notice, but I noticed it, and it feels good taking care of Cammie. I'm always pouring into other people, but I really never really poured into me due to my work habits. But I have gotten older and have matured and know that it's about me now. And still can pour into other people, but I'm pouring into me.
So I lost the weight in like 3 months, and I didn't really notice. I was noticing my body had changed.
But some of these people are trying to steal my identity.